So how do we manage these anxiety disorders around pregnancy and in that first year after the birth? There are useful ways to think about management with respect to prevention, with respect to working with partners, and with looking at detection strategies and then at treatment strategies. So with regards to prevention, if somebody has a history of mental health problems, and in particular anxiety disorders, ideally one would want to have those disorders well managed, well processed as much as possible before the pregnancy begins. There needs to be a process of conversation with health providers, conversations that are happening in the home around the disorder. If there is an openness to understanding what the symptoms may be, if there is an openness to being aware that symptoms may occur again or get worse during pregnancy, then the entire community or team that's supporting the mother can be teed up to support her preemptively before the pregnancy happens, and could also potentially assist in detecting any changes or shifts or needs as early as possible. And we know that when these problems are picked up early, and when people are shifted into treatment plans early, people get better quicker. And one can avoid a lot of the more severe complications and the more severe symptoms that can occur. So that is important to think about with respect to prevention. Then with respect to detection, how do we detect these disorders? And of course, the family and the partners and the people who know the mother may be able to detect a change in behavior, may be able to detect a change in the kinds of thinking that the mother is expressing. But health workers really do have a responsibility to screen for the common mental disorders, and there are well-validated screening tools available that do detect anxiety. And these are simply a set of questions that ask about the symptoms, that may ask about the duration of the symptoms, how long these symptoms have been experienced for, whether there's any impact on functioning. And there may be certain cut-off scores above which a woman may be very reliably referred for further investigation and further assessment to see whether there is in fact a diagnosis of an anxiety disorder. So in fact, all primary care providers, all providers of maternity care should have at their disposal the use of these screening tools, and it should be an ordinary and routine part of maternity practice, so that when women are having their blood pressure checked and their urine checked, they're also having their mental health checked at the same time. If we make it ordinary and we make it routine, there isn't any stigma, and it's part of seeking to address the wellness of the mother in her entirety. Another possible feature of the anxiety disorders might be the situation where a mother has thoughts of harming herself, or actually has behaviors which involve harming herself. And this can be extremely distressing for the mother or the people around her. The thoughts can be quite intrusive, quite persistent, quite vivid, and sometimes the behaviors can range from planning how one might want to hurt oneself, or actually inflicting some kind of physical injury onto oneself. This is usually a sign of extreme distress. It may be a sign of the underlying disorder, anxiety itself, or it might be linked to depression. It's vital in these circumstances that you speak to somebody about these feelings, these experiences and thoughts, if you have them, and make it absolutely clear. This is not something to be ashamed of. This is something that is an indication that professional help will be needed. So what are the specific treatment options that are available? Thankfully, there are actually a range, there are a menu of treatment options for anxiety disorders, and people do get better. People may need more than one of these treatments to be made available to them. They may need to play around and find the different combination of treatment modalities that suit them, but they essentially center around, in the first instance, any of the talking therapies. And these are therapies that can be provided by trained, supervised counselors. Doesn't necessarily have to be a qualified mental health specialist, but there are other trained counselors that can very effectively deliver some of the talking therapies, such as cognitive behavioral therapy, interpersonal therapy, problem-solving therapy. These are all therapies that have shown in trials with proper, well-conducted research to have a very positive impact both for depression and anxiety. So it's useful. You may be killing many birds with one stone with these therapies. Of particular interest is cognitive behavioral therapy, which has been thought to be particularly helpful for people who suffer anxiety disorders. And this centers around examining the cognitions or the thoughts, the unhelpful cognitions and thoughts that people with anxiety experience, and trying to reframe those thoughts, trying to challenge them, trying to provide alternative, more helpful thoughts through a process of talking about them and exploring what the thoughts may be, and linking this process of shifting unhelpful thinking to behavioral activation, which is scheduling pleasant, pleasurable, easy to do activities for a person to try and stimulate a sense of being in the present, a sense of joy, a sense particularly of connecting with other people. So it's scheduling activities in a slow and safe way that the woman is comfortable with, to linking with people in one's life, like friends and family, going out, doing pleasurable activities in nature or with loved ones. The other effective methods for the anxiety disorders that should always occur in tandem with these therapies are various relaxation techniques, the avoidance of certain foods and caffeine containing drinks that can really make the symptoms of anxiety much, much worse and can affect sleep. And with sleep deprivation, that itself can make anxiety worse. So looking at caffeine intake, looking at adequate nutrition, adequate exercise, these are not nice to haves when it comes to anxiety. These are the essential parts of managing the symptoms of anxiety. Interestingly, another evidence-based method for managing both depression and anxiety is mindfulness. Mindfulness is linked to the cognitive behavioral therapy approach and has an enormous neuroscience evidence base behind it. It is essentially a practice of being present and aware in the current moment, and of orientating one's thinking to a gentle, compassionate view of oneself, of accepting the discomfort, but at the same time being open to the physical sensations and to the joys that are present in the current moment. And it allows people, when they practice this very simple meditation, and it's not at all religious, when they practice it often enough, certain pathways in the brain are regulated and much more effectively. So the neurochemical pathways that help activate the anxiety response and the fight or flight response are much more easily regulated in the brain. So mindfulness, linking to breathing techniques, yoga, a body scan approach where you are in a systematic way linked to the experiences of the body, whether they be pleasant or unpleasant, so there's no judgment, can be very effective as well for anxiety disorders. And there are various online applications that one can use for mindfulness approaches that are free of charge, and there are various practitioners or groups that would offer a guided mindfulness training so that the practice can occur regularly on one's own. The other thing to mention is medication. The antidepressants, and in particular a group of antidepressants called the SSRIs, or the serotonin reuptake inhibitors, are very effective medications both for depression and for anxiety. They're equally effective for both. And even though there is a lot of bad press about the use of antidepressants in pregnant women and in breastfeeding women, in fact, there is more and more evidence to show that when these medications are prescribed carefully, under the careful supervision of a health practitioner who understands all the risks and all the benefits, that in fact it can be safer to be on antidepressants for the baby than it would be not to be on antidepressants for the baby, because of the benefits that people experience in terms of their well-being. It's important to know with these medications that they can take up to 6 weeks to start having any benefit or work at all. Some people experience benefits within a couple of weeks, but we say don't expect anything for 4 to 6 weeks. The other thing to know about the SSRIs or these antidepressants is that there may be a period of 7 to 10 days of feeling quite agitated, almost as if you've had too much coffee. And that is a side effect that occurs and settles invariably after the first 7 to 10 days. If you warn a person about that, they can overcome those side effects. And if you also slowly bring up the dose until there's a therapeutic effect, if you slowly titrate that dose up, that might also help to avoid those side effects. The other thing with antidepressants is it really needs to be a commitment of 6, and now they're saying 12 months duration. This is a medication that is most beneficial when it's seen to be taken as a chronic medication. And many women are on this medication for several years. It keeps them well in between pregnancies and then in subsequent pregnancies. These are not addictive medications. They don't cause any addictive response. There are different types, so one can experiment with one type versus another with respect to side effect profiles, with respect to effectiveness. So these are drugs that need to be considered very carefully in people who have more severe forms of the depressive and the anxiety disorders. It is important to realize, as for any prescription drugs, but particularly around pregnancy and for women who are breastfeeding, that these are medications that need to be prescribed by a qualified health professional for the person that they are intended. The idea that the medication can be borrowed from a friend or a neighbor or somebody in the house can actually be quite dangerous, so they need to be prescribed for the person that they are intended for. Many people with anxiety disorders who may also be experiencing sleep problems may be very tempted to use sleeping tablets or sedatives or the benzodiazepine family of medication. Unfortunately, this type of medication may in fact be addictive, and it doesn't necessarily address the underlying cause at a chemical level that the antidepressants do. So in general, these medications should be avoided altogether or used extremely carefully in connection and in collaboration with a qualified doctor. It is absolutely critical to look at the quality and the type of social support that women with depression and anxiety get. Social support is key to getting better and is key to maintaining wellness. It's key to nurturing parents and their infants as they develop and grow in the world. Unfortunately, when women have depression or anxiety, they tend to back away from social support. They don't feel that they have the value that warrants social support. Their self-esteem is affected, so they may not reach out. They may not take up social support opportunities when they are there. Any family member or partner of a person who's experiencing anxiety may need to work a little bit harder to link the mother into social support networks. But these are very often absolutely critical to her recovery. And these may be as simple as a network of old friends meeting on a regular basis for a cup of coffee. It may be a group online chat with other mothers in similar conditions. It may be a religious grouping that meets. It may be an opportunity to volunteer at a local community organisation where you get to meet and link in with other people every week or two. Linking in with family who may not know that their support would be highly valued, and calling in and drawing in the potential supports that are out there. Sometimes just structuring the practical support so that over a period of time, family and friends may have a roster to deliver meals or to look after older children while the mother is resting. It is part of this entire system of social support to look at partners. Fathers or partners of mothers experiencing anxiety or other common mental disorders are often experiencing the same disorders themselves. They may well be suffering, and the suffering of the two people in the relationship needs to be addressed equally, importantly. When a partner is suffering from anxiety or depression, that can impact the relationship and cause conflict, which can make the symptoms for both people in the partnership much worse. And it also means that the partner is less able to provide the support to the mother than they usually would. So when a partner is worried and anxious about things, when a partner is sleep deprived and is feeling very low, that person can't be there emotionally or practically for the mother who's experiencing anxiety. So we need to open up those conversations in our homes, with our health providers, in our close circles, so that we can see everybody's wellness around this emerging family as critical to the well-being of that family. And linked to the issue of partners or fathers is the fact that we need to remember that we can draw on partners or fathers who are the closest person to the mother to assist us with detecting whether the mother is experiencing any of the symptoms of anxiety or depression. So a mother might well say to her partner at the beginning of a pregnancy, you know what happens when I'm getting anxious or low. You know what happens to my functioning and my thinking and behaving. Please, would you be a person who would assist in picking those things up for me? And in that way, we can attempt to get help as early as possible. And likewise, in the opposite direction, when a partner is experiencing any of the same symptoms or disorders, the mother can play a role in helping to pick these up and to detect these early and getting the right help as it is needed. Of course, there are many women who find themselves in the position or choose to be in the position where they do not have partners in the perinatal period. There are women who find themselves disconnected from their families on other sides of the world, from parents and loved ones during this time of vulnerability. Especially if these people are experiencing anxiety, it is absolutely critical to link in with social supportive networks, to link in with friendship groups, to link in with community activities, to link in with church-based activities, so that that sense of isolation, which makes anxiety that much worse, can be dispelled. To realize the value that you may have in contributing to these networks on the one hand, but also to realize that the incredible value that one gets from being in society, from being connected with other people. That is critical to recovery from anxiety and depression. One of the biggest factors that stops people from getting help is the issue of stigma. And unfortunately, the mental disorders are highly stigmatized, even in this modern time. It is absolutely important to realize that the common mental disorders, depression and anxiety, are common. About 1 in 5 or 1 in 7 women around the perinatal period will experience this. This does not mean that these people are crazy. This does not mean that these women will be bad mothers. This does not mean that these women are somehow lazy or have brought this upon themselves. This does not mean that they will not get better. What it means is that these are illnesses just like People might experience physical illnesses at any time in their life or around pregnancy, and that every person warrants the care to have these addressed properly, comprehensively, and every person may get better and should get better with the correct treatment. A critical part of managing anxiety disorders is to look at the whole issue of sleep. Sleep and anxiety may well occur in a vicious cycle. By that I mean people who are experiencing anxiety disorders often struggle with sleep, but then the sleep deprivation that results can actually make the symptoms of anxiety much worse. So on the one hand, we need to look at managing the anxiety, which may improve the sleep, but if we look at managing sleep in some very practical, simple ways, getting more sleep might improve the anxiety. So how do we manage sleep problems? There's some basic ideas that a lot of health professionals will share, and they are sometimes simple enough to institute in one's daily life. Caffeine stops people from sleeping, and your tolerance to caffeine may change when you're pregnant and in that first year after pregnancy. So to avoid caffeinated drinks altogether, or certainly after lunchtime, would be the first step that one should take if one's struggling with sleep. Regular exercise also helps regulate the whole rhythm and metabolism in the body, which assists with people falling asleep and staying asleep. Looking at how lighting is used in the room. If one's waking up at night and needing to feed a baby or comfort a baby, to keep the lights as low as possible and not put on any bright lights if one's going to the loo, helps the brain's hormone levels stay attuned to what they need to be to keep a state of restfulness and calm and sleep. Linked to this is the use of screens, computer screens, television screens, and cell phone or tablet screens. There is a particular light wave that is emitted from these screens that stimulates parts of the brain to stay awake. So one should either avoid use of these screens as much as possible, or one can actually get filters for the blue light that is emitted from the screens. When the baby is resting, or whenever an opportunity presents itself, like somebody offers to look after the baby, or somebody takes the baby for an outing, the person who's struggling with sleep and anxiety should themselves, if possible, take that opportunity to rest and to consider it not as a luxury, but as an essential part of being well, where the temptation may be to get a whole lot of activities done, and especially if one's anxious or worried about things, one might be checking, one might be cleaning, one might be doing a whole lot of activities, rather to try and look at those behaviors and look at those conditions as opportunities rather to rest and recover and to be well. So in summary, in pregnancy and in the postpartum period, anxiety disorders are extremely common. About 1 in 5 or 1 in 7 women will experience these disorders. We need to understand these disorders as mothers ourselves, as people who are linked with mothers, as people who are caring for mothers. We need to know how to detect the symptoms and the signs of these disorders as early as possible. But if these are detected late, in either instance, there are a range of opportunities to manage this problem or this range of disorders so that people can recover, people can get better, and have the opportunity to enjoy this particular period and to find the nurturing that they need and to find the space to learn to be parents, to learn about this new relationship with the baby, and to experience the love and to be able to give the love to the new child.